Hey, everybody. So, thank you so much for joining me for our show on Mind Your Health podcast. Today, I want to talk to you about how your alignment means the most in terms of living the most successful life with autoimmunity. I really want you to understand what I mean by the medical system is failing. Here's the fact, right? They know disease, and medical doctors are trained to know disease, to diagnose, and then to treat them. That's all they know. And what they can offer is a medication, right? Because pharmaceutical companies are what drives the whole medical system. And that's their business model. Knowing that, I know that really the research is beneficial and it's in my best interest, especially when I'm experiencing acute flares in my autoimmunity. When I have a motor vehicle accident, some type of an acute fracture in my bones, I want to be able to go to the emergency and I want to know that my doctors are there to treat me. Totally get it. I'm talking about the long term effects and long term goals and visions that you should have for your life in living with a chronic condition like autoimmunity. Because all doctors are trained to tell you that it's not curable. And it's a liability issue, right? It is not curable. And even when your labs say otherwise, they're always scratching their heads and they will tell you you're in remission, but they'll never tell you you're cured. It's as if you have an ICD-9 code. It's a coding system in the medical system to diagnose and give you a code to be able to bill services when the practitioner sees you. That code stays with you. And so it's like once you get diagnosed, you can't even get life insurance? All those things are out the door. And it's hard for you to get healthcare insurance. And thank goodness for Obamacare that we are able to get some health insurances, but besides that, it wasn't even possible. So I really want you guys to understand what sick care is so that you can have a greater perspective and understanding in knowing what your role is in taking care of you in your healthcare. Because what is health, right? We call it healthcare practitioners, healthcare, and doctors care about your health. Well, doctors treat disease. And most of you don't even go to a primary physician if you're not sick. And so when you're ending up at the doctor's office, that means there's something going on with you that you want a medication for. We all expect it and we want to do colonoscopy. There's some breast exams that we do. There's some standard things that we do like pap smears and everything. Those are all preventative measures, hoping for the best that nothing is wrong. Outside of that, it's really sick care, you guys. And you want to make sure you understand it. Your goal in life should be to stay out of the sick care system. I know intimately the healthcare system is failing, especially for us, because for those of us who are living with chronic conditions, because what I see so often is we get sick, we get a flare, we get on a medication, and then that medication has side effects. So then we get placed on another medication, and then that medication then has secondary effects. Then we need another medication. So the list grows and grows and grows. I've been a clinician for 20 years. And you know what I used to do? In California, when I was a registered dietitian, I used to pay visits to elderly homes to make sure that there was food interactions and drug to drug interactions. What I found, I was part of this research. What I found was that these senior citizens, elderly people, were getting prescribed so-and-so from a cardiologist, so-and-so from a pulmonologist, from a OB-GYN, a gynecologist, and even primary care, and nobody was talking to each other. And this is before EMR system, computer systems, and they have tons of medication. They didn't even know why they were taking these medication. What you have to know is that there is a big pharmaceutical industry that does benefit from us being sick. There are systems in this life, right? There are certain systems, business systems, that benefits from keeping us sick. So you really have to be vigilant about what it is that you're going to do. Because today was one of those days where I had to do a lot of clinical work and I had to see a lot of patients. And I work a little bit PRN for this innovative medical health integrative center. And there I saw many of the patients that come, and their ages range anywhere from 40 to 80. And I can tell you that when you're in pain, especially with musculoskeletal, and they become debilitated, they're chronically being prescribed medication, so much so that they get dependent on it. And it doesn't take the edge off. And then it slowly degrades at their gastric lining, so much so that they need something else for the gastric issues. And if your gastric issues persist, then it starts to really cause a problem, because it's the barrier to the outside world. And then I swear, I believe right now in our state, autoimmunity is on the rise, especially pre-autoimmune. I can tell you, of the 10 patients that I saw today, probably 8 of them were pre-autoimmune. There was a woman in her 40s, fibromyalgia is what she was told. And she was getting nerve conduction studies, MRIs, EMGs, and all the testing. All the testing couldn't really pinpoint why, but she was in tears. And she was telling me that, her life is not her own anymore, because she just wants to go to sleep and never wake up because she's in so much pain. And all doctors keep telling her is to take these medications, and she's getting treatments and going to physical therapy over and over and over again. But nobody's addressing her as the person. And these are the scenarios where I feel that you, as the patient, need to start to be empowered to know what you have control over. And what you have control over is really the lack that we have in our medical system. We must involve you as the patient to engage in your own care, to empower you, not keep disempowering you. Because if I hold myself as the expert, hide behind the lab coat, and tell you exactly what you need, I'm doing a disservice to you in your care. So I really want to urge you to really align yourself to the clear vision of exactly what you want to create in your life. Especially health creation is up to you. And I know many of you who are going through severe flares and whatnot want to just shut me off, and it might trigger you in some way to say, but I really have this disease, right? So I usually say, because having gone through really the severity of what lupus can do in your physicality, I've been really sick before because of an autoimmune condition, just like you. And I struggled. And I know that the answer is not in a pill, a supplement, or a diet. Those things can marginally help you, but what's really going to heal you starts from the inside out. You have to change your perception, the lens by which you see the world, but more importantly, the lens by which you see yourself. Unless that changes, nothing else will permanently change. All the dogmatic approaches of changing this diet, changing this supplement, taking that adaptogen, every year there's going to be different. Doing this test and doing that test, and holding on to these stories of external environment has all the answers, and we're just waiting passively as bystanders for them to come up with the research to heal and cure us. That's never going to happen. It's always going to be another medication. Now, I want you to, short of a miracle with AI, which is artificial intelligence, I hear that there's a lot of groundbreaking research being done with stem cells. Short of a miracle, right now, your responsibility in your healthcare is huge. You have to stand in your power and really muster up the commitment, the courage that you need, gain the capability to really gain the confidence in knowing that you're the one in charge. You're the one in charge of this health and this life, and you can absolutely do this. And you need a team of professionals that need to guide you and support you. Come to our group. It's called Autoimmune, Tribe of Autoimmune Health Rebels, because I want my role in life, my mission and vision in life is to make sure to end all unnecessary suffering in the lives of disempowered autoimmune patients to become empowered rebels in their own right, to start to create health and life of their dreams, because that's absolutely possible. And it's one message that is lacking in our community of autoimmunity. I'm here to tell you, you can absolutely do it. Come join me. We just finished our 1 week training, and carts for my program closes tonight. If you're interested, get in the group, learn more about it. We've got all the things, but cart closes tonight at midnight. We're going to continue to work and refine this work, but I'm hoping that many of you come join me in this movement that I've created to create empowered health rebels in our community who hold space for one another to grow and evolve beyond just surviving. We want to be thriving in our lives, and that's absolutely possible. Believe me, believe in you, and that's where it all starts. So don't underestimate the power of miracle, and that miracle is only possible if you enlist in yourself, in your own self-care. And that's what's really missing in the messages being told on the internet. The power is within you, my friends. And with that, I'll see you guys all soon. Thank you so much for tuning in, and I'll see you guys all next week.